Hi everyone, I'm Suzanne Boyd. Welcome to Learn and Share, brought to you by the Commonwealth Project. We hope you not only get something out of this programming, we also want you to share with your loved ones. Talk to them about what you've learned. You are not dependent on the news of the world. This is your moment to control the communication in your world. Enjoy. Hi everyone, I'm Suzanne Boyd. Welcome to Learn and Share. Well, today we are tackling a topic that may be confusing for a lot of people, but we are going to lay out a very simple explainer about cannabis for health and wellness. And joining me today is someone you're familiar with, Dr. Melanie Bone. She has an office at MorseLife and is familiar to the residents there. She is also an expert in not only CBD, but also medical marijuana cannabis. All right, so let's start off by talking about the history of cannabis, because I feel like this is something that a lot of people don't realize had been legal in the US until the 30s.
Right. I love the history of cannabis. It's so interesting. If you look back 12,000 years ago, cannabis arose in Middle Asia, not far from the Himalayas mountains, right? And then it slowly over time made its way all the way around the world. And it was used as medicine dating back thousands of years. So for example, there was a gentleman named Pliny the Elder in 80 BC. And Pliny the Elder used a paste of marijuana to help stave the hemorrhage of childbirth, and also on sore joints for gout. And they were using cannabis as much as 1,500 years ago for glaucoma. I don't even know how they knew it was glaucoma. But anyway, and you fast forward and you see that cannabis was used in many different ways. It was used as a medicine. It was used as a religion. In other words, people used the cannabis as part of the religious experience, and it was used for recreation. You know, they found a mummy of a woman who was very young with cancer, a breast cancer, very young woman from thousands of years ago, and in her grave she had with her cannabis, which was probably something she was using to control her symptoms of her cancer back then. And
that's really what we're talking about today, is sort of the health benefits, the wellness benefits, if you have ailments, how it treats those ailments. Let's talk a little bit about some of the common complaints that people have that can be helped by cannabis.
Okay, so if you just look back, even in the United States, before 1937, when cannabis became illegal, people used cannabis up until that point for common ailments. So it was in things for tummy upset, for joint pain, for sleep, for agitation, depression, anxiety, poor appetite. It was used for a whole host of things. And it was in many tinctures that were for sale. And we're finding that it really does work for many, many of these things. We don't always know exactly how it works for some of them, but we have a pretty good idea for many of the ailments.
And we were talking before about THC, and we actually produce that, you said, in our bodies.
Yeah, it's really cool. So in your body, you have an endocannabinoid system, and that endocannabinoid system has THC and CBD, which we'll go over in a minute, and you actually make it in your own body. And it's kind of like, you might have heard of the endorphins, which are our natural morphine. And our body makes natural morphine, and we think that that helps with pain in our body. And we make our natural THC and our natural CBD. And those are called endogenous. When we add from the outside world, we call that exogenous, from the outside. And there's from a plant, which would be called phytocannabinoids. And then when we have it not from a plant, but from a factory that makes synthetic, that's exogenous synthetic
So we've been using synthetic THC, you said, in hospitals for years.
Exactly right. So when you have, for instance, poor appetite from cancer or side effects from chemo, for years we've been using a drug called Marinol, which is in fact synthetic THC. It's made in the factory and given by pill to patients, and it works. I think in some patients it has more side effects than the natural product, but I kind of liken it to being a gynecologist, and we have synthetic estrogen and natural estrogen. Right. And some patients like one, and some patients like the other.
And some people have enough of the THC in their body that they don't need anymore, but some people do need a little extra, is basically what you're saying.
Exactly. So we believe that your body requires a certain amount. And for people who lack it, we have something called endocannabinoid deficiency syndrome, which if you think of like your thyroid gland, when you don't have enough thyroid, we give you a little more thyroid to get your levels up to normal. That's the idea. For people who are suffering, chronic pain is a really good example, inflammatory pain. Those people seem to respond nicely by giving them some exogenous phytocannabinoids.
Let's talk about, so what is a cannabinoid? How is that different from cannabis or from the marijuana plant? Does it all mean the same thing?
And they use such funny, hard to pronounce
so many words. Big words.
I know, big words. You know, but that's medicine.
Right.
If you make it hard to pronounce, you're smarter. But that's not really true. Anyway, here's a theory. A cannabinoid is an element in the cannabis plant that has an activity in the body. So the main ones that most of you have heard about are THC, which has the H in it, and it gets you high, and CBD, which the first letter is C, and we think it's calming. It calms you down. And I always think of it as a little bit of a seesaw. Mm-hmm. You know, if your THC is a little too high, if you give more CBD, you come back more into balance, all right? But everybody's different. And some people need a lot of this, and some people need a lot of this. But those are called major cannabinoids. They're found in the largest concentration in the cannabis plant. Cannabis just meaning the whole. It encompasses actually both hemp and what we call marijuana, which is really not a term. Medically, it's cannabis. Mm-hmm. So you have cannabis and you have hemp, and they're all part of the greater cannabis scheme. And then you have these things called the terpenes. The terpenes are one of my favorite parts of cannabis. They're the aromatherapy of cannabis.
So like essential oils?
Exactly. So for example, you have cannabis that's naturally high in one of our favorite ones, lavender, which what do we use lavender for? When we get a massage, relaxation, sleep. And that, the term is technically Lin Ahlul. Lin Ahlul is the molecule that makes lavender smell like lavender. But when you have a marijuana that's high in lavender or Lin Ahlul, it would be more relaxing than, let's say, a marijuana that's high in limonene, which is the smell of lemon, or pinene, which is the smell of a pine forest. So these molecules actually go up your nose into your brain, and they affect the way the marijuana works. So we look at how much do you need of this, and how much do you need of this, and what do you need of over here, and that's how we figure out what marijuana is good for you.
I think that is probably the confusing and also maybe a little bit of the scary part of cannabis is that, you know, do you know what you're getting, right? And so you take a pill from the doctor and you know you're getting the right amount of the medicine every time. Right. And I think the confusing part about cannabis is how do you know what you're getting, right?
And I agree, because cannabis is a plant, and as much as the dispensaries grow it in very controlled facilities I've been to see, it's the temperature and the light and dark and the moisture, and they use ladybugs, for example, to prevent other insects from getting in. It's very interesting, but it's a plant, and plants are imperfect. And so if you go by what's called a strain, and they have these very funny names, you know, Durban poison, you know, Granddaddy Kush, whatever. But from year to year, the strain might be a little bit different. I think of it as if you have grapes for wine, you blend grapes so that every time you buy this bottle of wine, it tastes the same.
Similar, right.
So we blend marijuanas now so that every time you get that, it's the same. But that's not usually in the form of what you think of marijuana, of this little green stuff that you roll a joint or you put in a bong or a pipe. True medical marijuana, the way I think I like to practice it in this group of people who have chronic pain and these other ailments, is I want a ratio. I know that every time I give it to you, you're going to get this much THC, this much CBD, and I can control it and make it uniform, which is how you know a little more what you're getting.
Yeah. So when you get your medical marijuana card and you go to the dispensary, you have a very clear idea when you go to a doctor who recommends something for you, what you should be getting, and not just taking the advice of the kid behind the counter, right?
The bud tender, I love that. Bud tender.
Bud tender.
You know, like a bartender, but because they're doing marijuana, they call it a bud tender. I really believe that if you have a good practitioner, they will say to you, listen, for your ailment, I think the best ratio of THC to the other CBD cannabinoids is going to be maybe 1-to-1, half CBD, half THC. The beauty of that ratio, it's very balanced, and it's usually not going to get people very stoned or high, which is something we'd really try to avoid in medical marijuana. But it also can get the job done, and it's a good ratio for many ailments. If you go very high THC, it might be really good for appetite, right? And it might be very good for some pain, but at the expense of getting high. Yeah. If you go on the other end and you give very high CBD with only a little THC, it's good for calming and for some inflammatory conditions, but it may not have quite enough for the pain component. So we're always balancing,
juggling,
and seeing how your body responds, and then adjusting the dose.
Well, I think that's with any kind of medicine, right? So you know, if you come in with depression or anxiety, there's so many drugs and so many cocktails of drugs that you can have for that sort of thing, right? And so you have to see how your body reacts to all of that.
That's right. And people will often argue with me, oh, but it's not, you know, an exact science. And I say, but you know, when a doctor gives you a pill for depression, let's say, and you go home and you call 2 days later and say, oh my gosh, it made me dizzy, it made me nauseous, that's a side effect. And you don't say, I'm never going to try another antidepressant. You say, I guess I have to go try something else. But with cannabis, I think there's this idea that if the first one we pick isn't right for you, that we don't know what we're doing and it's a bad science. And would tell you across the board about 30% of people will give up. And I don't blame them and I don't judge them. But if you're willing to work with your cannabis doctor, I really think you can find something that will work. Yeah.
And is this something that you could eventually give up some of those medications, the pain medication, the anti-anxiety drugs, if you find something that really works for you?
So that's what keeps people like me still practicing, is when we have people come in and they have all those complaints, and then they come back a month later and they say, oh, Dr. Bone, I've completely given up my pain medicine. Wow. And I don't even expect that. I think if I can decrease you by 50%, I'm doing great. But I definitely, with antidepressants, anti-anxiety, sleep medicines, and pain medicines, we see a really big reduction when they find the cannabis that's right for them.
Right. Well, let's talk about some of the ailments and sort of that mix between the CBD and the THC and what works better for each of them. So let's start with like joint pain. What is the best? For that.
So what's interesting about joint pain, there's joint pain that's inflammatory, which we call osteoarthritis, the most common arthritic complaint that we have, right?
That's kind of the go-to when they need you to to have a diagnosis, right?
It's like arthritis. We all have arthritis. You live long enough, you get arthritis.
That's right.
And what's interesting is you can see people with a lot of arthritis without a lot of pain, and you can see people with kind of mild joint deformations that really have a lot of pain. So I would say you need the CBD for the nice anti-inflammatory component, but you need the THC for the pain management. In someone who's naive to marijuana, never had marijuana, or somebody who did it once in college and had a bad experience, I always will start lower on the THC, okay? Because if you give them CBD and they get tired, I think they can understand that. I'm tired. It's from that new medicine. I'll get through it. But if you give them too much THC and they get very high and they get dizzy, it's really a disincentive to keep going. So I will usually start at higher CBD than THC for a chronic pain condition. So one of my favorite go-to ratios is 5 of CBD to 1 of THC.
Oh, okay.
All right, so I think of it as M&Ms. If you have green M&Ms and a red M&Ms, so you would have 5 green M&Ms and 1 red M&M. You definitely would see the effect of the green M&Ms more than the red M&Ms.
Right.
And if you do that and you don't get resolution of your symptoms, then I would move to 5 green M&Ms, 5 red M&Ms, equal parts. And then we start doing it the reverse, maybe 3 green M&Ms and 5 red M&Ms. And then eventually, if you needed to, you can get up to all red M&Ms. But at that point,
that would be if you're having pain, right?
Yeah, that would be for the pain component.
Right.
I will tell you again, balance, equal is probably my favorite for arthritis, or maybe a little higher on the THC.
Yeah.
But definitely all CBD or all THC would be unusual to have good resolution of chronic arthritic pain.
Let's talk about sleep issues, because I feel I've got sleep issues, Dr. Bone.
Have I met anyone that has a good night's sleep in the last couple of months? No.
I know. You know, and for me, it's not the trouble falling asleep, it's the trouble staying asleep. At 2:30, wham, I'm up every night, you know, and it's very frustrating.
Terrible.
But it depends on what your ailment is for sleep, right? If you're having trouble falling asleep, it would be different than if you're waking up like me in the middle of the night, right?
Right. So sleep is really complex. There's trouble falling asleep, trouble staying asleep, both trouble falling asleep and staying asleep. And the very first part of this is you must rule out other causes of sleep issues. All right, in America right now, anxiety probably tops the list of reasons people have trouble sleeping. They have trouble falling asleep because they're thinking about, oh my gosh, am I going to get this virus and what's going to happen to my family? Or I'm on isolation and I can't talk to my family and this is making it hard for me to rest. On the other hand, maybe that person has sleep apnea. You know, sleep apnea is where, if you've ever heard somebody who snores really badly, and then in the middle of the night,
they're like their breath
they
stops.
hold their breath, and then they go, right? Okay, I love that. That's sleep apnea, and sleep apnea wrecks your sleep so that in the morning you feel exhausted, you don't think you had a good night's sleep. So diabetes is another one. There are people who are diabetic, and in the middle of the night, their blood sugar is dropping, and it wakes them up. And so you have to rule out some of the causes of sleep issues first. But that's fairly easy to do. And once we establish that you just have garden variety insomnia, then we work on which part bothers you the most. So let's say it's falling asleep. So falling asleep, to relax people and calm them down, I usually would go to a higher THC product, but one that has more of the lavender, Lin Ahlul in it. To stay asleep, I like to increase the CBD because I think the CBD really helps to, I joke, put the brain in neutral while you're sleeping. So if you get up to use the restroom, your brain doesn't immediately engage again.
Yeah.
And so what I will do is combinations. So I'll say to people, maybe you'll take a puff of a higher dose product just to relax you when you're in bed, but take drops or a capsule of a more medium what we call an indica strain, which is high in lavender, to try to keep you asleep longer. And there are people who wake up in the night and have to do the whole thing all over again, another puff or whatever. But we have pretty good success with insomnia.
Yeah. All right, so let's talk about what was our next ailment? Anxiety and depression. Yeah, because this is a big one right now, obviously. I mean, so many people, I just feel awful. I feel awful for so many people, and especially people at like MorseLife that can't have visitors, you know?
Exactly. And although we're never going to give these people a formal diagnosis of PTSD, let's face it, when your relatives can't visit you and you can't visit your relatives, and you hear stories on TV all day long,
and your routine has changed, and
your life has turned topsy-turvy. So what can we do? For those people, I actually like more CBD than THC. If you look, there's something called the Cannabis wheel, and it gives you different ailments, and it recommends different combinations of cannabinoids. For anxiety, there are many places where they don't even use THC. They just use different amounts of the CBs, right? CBD, CBG is very good. I think the sweet spot is a teeny bit of THC and more CBD for anxiety and depression. So for example, that ratio of where we have the 5 green M&Ms and the 1 red, I love that one. Or maybe even 10 or 12 green M&Ms to 1 red M&M.
Oh, okay.
So very high in CBD, because anxiety makes you, some people have what I call agitated depression, agitated anxiety, where they want to move around and they can't stay calm. That CBD helps them. And then if they go to the other side where their depression, it's kind of like not letting them get out of bed every day, then we add a little more THC for the energy factor. But usually higher CBD than THC.
And you had said CBG. What exactly is that?
So CBG is the grandparent cannabinoid, we call it. See, it's kind of interesting to look at the science behind it, not to bore you, but both CBD and THC have this group at the end. It's an acetyl group. So they're raw form. Like you pick the plant, you can't eat the plant and get high because it has raw cannabinoids, and they need to have that A removed to be activated. So that's why we process marijuana before we give it to you, and it's heat that takes the A off, right? Which is why you combust it with a flame. You heat it, the A goes away, you get the active ingredient. So CBG is one of the grandparent cannabinoids that then becomes THC and some of the other components, because it degrades and it gets acted on. But alone, CBG has been shown now to have some very interesting properties, especially for things like anxiety. We need more studies because the amount of CBG in most of the cannabis we get is small. So we have to isolate it and maybe add it back or do some isolation studies on the isolate before we'll know.
All right, let's talk about appetite, right? Because that's a big one. If you have a poor appetite, and this is big, like for people like my mom who is going through chemo for pancreatic cancer, right?
Exactly.
So this is a really good cancer.
Yeah, and for some reason, as we age, also our smell, our taste, and our interest in food becomes less for whatever reason. It's just like our taste buds aren't as good as they used to be, so things aren't as exciting to eat. When you're younger, we all like to eat a lot, right? So
I'm still in that.
Yeah, I know.
And I'm not that young.
You're so funny. Well, so we find, if you remember the classic movies on marijuana, people get high and they get the munchies and they eat all sorts of junk, right? Okay, that again is because of the cannabis, the THC. So for appetite, we generally go with a higher THC product. We just start at a very low dose.
Yeah, and there is some component of people having some anxiety around eating, right? And so that's a different recommendation than if you are having some appetite issues, correct?
Exactly. So if you really are getting anxious about even approaching the table because you're not sure you're going to want to eat, I recommend even some CBD to help with that moment of anxiety and some THC to help with the appetite. And we sometimes do them in different form factors.
Yeah. So I know we had talked about this when we did the CBD show, but I really want to go back to sort of the modes of how you administer the drug, right?
Yep.
So what are the different forms of being able to get this into your body? Because I think the smoking thing is, or the vape,
Vaping.
it just doesn't feel right
It's
for a lot of people.
Bad rap because of, but what's really interesting that we've noticed is with the United States on lockdown right now and access to street vapes, which were the ones that were responsible for vape lung, that's kind of gone down
away.
Dramatically.
Yeah.
And we aren't noticing a lot of problems with the organic products that you're getting at the dispensaries. But I never push people to use a form factor they don't want to because that's disaster. So the most common way most people will use cannabis would be as a sublingual drop. So you have a bottle with a dropper. It has an oil of marijuana in it. You shake it well. You put the drops under your tongue. You leave them there for 30 to 60 seconds, and then you eat and drink normally. It may take a half an hour for it to work. Some people a little quicker, some people a little slower, but it will work and it will last 4 to 6 hours. I like that because you can control the dose by exactly how many drops, and I find a lot of people want to control that.
Yeah. So the vape or the inhaling it is the quickest way to get it into your system, correct?
Correct. So for instance, for appetite, if I can get somebody to vape a little 15 minutes before a meal, I really like that. But if not, we tell them to do drops 30 minutes before the meal.
Transdermal is for the joint pain and that
The
kind of
creams,
stuff, right?
the patches, the gels are great for joint pain, muscle aches. And the capsules, once you know your dose, if you're willing to wait 1 to 2 hours for it to take effect, you can take a capsule and it will last all day. So we do have people who eventually do end up on capsules once they're familiar with the cannabis and what they need.
Yeah. All right, let's talk about the experience at places like MorseLife. What with the different units that are there on campus and the different residents that are there on campus, what component would you use for the different residents? I mean, what do you suggest?
Sure. So I have a lot of patients from independent living, and in independent living, they're physically much more active. They get more of the complaints of arthritic pain, insomnia. And so I use all forms there with THC, no THC. But at the memory care unit, for example, where the patients have late stage dementia, we want them calmer, so we use much higher CBD in those patients. And so we modify what we use based on the condition and where they're located, and can they self-administer or do they need help, that kind of thing.
Yeah. All right, well, Dr. Bone, this was very eye-opening. Any closing thoughts about cannabis and what you want people to know?
So I would just say this. I know the instincts, especially if you were born, let's say before 1950, you were raised in a time when cannabis was bad and it was a drug and it was, the same as heroin for many people. But we now know that's not the case. And I certainly believe that eventually, really in the very foreseeable future, it will be legal in the United States. And I think if you can educate yourself, it helps so much to take away that fear, and it just affords a nice way to not have to use medications that have more side effects. And long-term issues. And for me, that's the number one reason I hear people want to go on it. I want to get away from pharmaceuticals.
All right, and if people want to reach out to you and get some more information, email is the best way?
You can email me at hello@drmelaniebone.com or call the office 561-706-0648. My nurse, Lisa, is always available as well.
Yeah, and you're doing a lot of telemedicine now, I guess.
We do everything by
Right.
telemedicine now.
Right.
It works wonderfully for cannabis.
All right. Well, thank you very much. That was very eye-opening. I really appreciate it.
Thank you.
All right, and we'll see you next time on Learn and Share. Now let's share this with your family and friends. Go to tcphealthcore.com and you'll see the Learn and Share programs right on the homepage. Also, for COVID-19 updates, head to MorseLife.org. We'd also love for you to tell us what kind of programming you would like to see. Is there something you've always wanted to learn? Email us at info@tcphealthcore.com. Continue to stay connected and learn and share.